Well, it's deeply concerning. We already knew earlier this week that in other countries there was evidence of community transmission, meaning that it's not just people traveling to the epicenter who brought back the virus, but that person-to-person transmission was happening in the community. And now it seems like this has happened in the U.S. And I'm very concerned because we don't have enough testing kits. And because coronavirus can be found in people with mild symptoms like a cold or even no symptoms at all, it's very likely that there are a lot more people in the U.S. who have coronavirus, but we're just not testing for it, and they're spreading it to other people.
Why don't we have enough tests?
Well, I don't know. We'll have to get the answers from our federal government. It seems like there was some problem with a reagent, but the problem is that even if these tests are now being shipped out, we still have to get these tests to be done at point of care, meaning that they have to be done in the hospital at bedside. The results have to be available really quickly. Right now, the confirmation the test takes 48 hours. It has to be mailed into the CDC. And we just don't have that kind of time. If somebody is suspected to have COVID-19, we need to find out right now so we can start quarantining that person or isolating that person. We can start tracing their contacts. And we really need these tests now. Other countries have figured it out. We have to figure it out, too.
Dr. Wen, what do you make of the messaging from the administration that we've had so far the last couple of days?
It's confusing. And this is the last time for mixed messaging. What the president should have said last night is that the risk for everyday Americans is very low at this point. But this is quickly evolving. This is a global outbreak. And things are going to get worse in the U.S. And here's what we should be doing to prepare for it. We are prepared. Our response has been effective so far, but we have to do a lot more. I think that kind of messaging would be straightforward, true, and transparent. And it's at this time that we need for the administration to come up with truthful, honest answers that are based in evidence and that rely on public health officials as the messengers of that information.
But Dr. Wen, I guess the pushback to that would be is you don't want to create panic, particularly when the U.S., by all accounts, and European governments don't have the same potential draconian tools to use like the Chinese did in terms of completely shutting down an entire multi-million population city. And in that sense, it's better to keep people calm than to create panic.
We know from studying public health risk communication that the best way to calm fears and stop panic is to tell the truth, is to say to the people exactly what we know, what we don't know, what we're doing about what we know, and what we're going to do if things change. That's what happens for all types of emergencies. That's what the public expects from us. And when the president tries to paint a rosy picture that's just not true, that's actually what causes panic. And it also seeds distrust in the government. Because if you can't trust your commander-in-chief to be telling you the truth, then who can you trust?
Dr. Wen, thank you for joining us again.